This is Tony Edwards. I'm the editor-in-chief of drbicuspid.com, and I am pleased to welcome Ms. Eve Cuny to our Google Plus Hangout. Ms. Cuny is the past chairperson of the Organization for Safety, Asepsis, and Prevention, known as OSAP. She is the director of Environmental Health and Safety and an associate professor in the Department of Dental Practice at the University of the Pacific's Dugoni School of Dentistry here in San Francisco. Eve, thank you so much for making time to speak with us. You are a recognized expert in infection control. You've received prestigious awards such as the James Crawford Award for Lifetime Achievement in Dental Infection. How did you get involved in infection control, and what continues to motivate you?
Well, Tony, thanks for having me here today. I started at the University of the Pacific way back in 1984. I was a teaching assistant at the time, and it was a time of big change because, as we all know, the AIDS epidemic hit pretty hard right around that time. In about 1986, our then infection control coordinator asked me to help him teach some courses in infection control. And by chance, that was also the same year that the CDC came out with their first guidelines for infection control and dentistry. Around 1988, the infection control coordinator left for another job, and I took over doing that for the university and continued to stay involved. Around 1989, I went to my first OSAP annual symposium, and it was just a huge eye-opener for me, and have been involved in OSAP ever since because it's been a great benefit to me to network and to learn throughout the years.
Very good. Thank you. So, what here you've seen much happen. You've mentioned AIDS. You've mentioned there's current other infection control issues going on. But what are the most important issues that face dentists and dental practices right now?
I think for dental practices, there's sometimes a difficulty in getting good, reliable information, and also there's concern regarding whether or not infection control is going to cut into production time, and how much is enough and how much is too much. And I think there are some things that dental offices really struggle with in terms of reliable information, where they get it from, and how they can access the current guidelines, standard of care, best practices in infection control, and have it not interfere with their day-to-day running of a dental practice.
Yeah, very good. So what steps can these practices take to ensure that they've got the most reliable and up-to-date information?
I think one of the things that they can do is they can appoint a safety coordinator in the office. I think that's a really important step that a lot of people don't think of. And it doesn't have to be a full-time position or a separate person. They can have it be an assigned duty to somebody who's already working in the practice, an office manager, a dental assistant, dental hygienist. Usually a dental assistant is the right person for it because they're sort of the constant in the office. And they are generally the ones who all of the infection control duties fall to. It's really important, though, if they do that they give the person the time and the resources that they need to do that job. It isn't something that can be done in a few minutes a day, but maybe a half a day a week could be appointed to this person, and they could take care of all of the monitoring, like the spore testing, waterline monitoring, reviewing protocols, reading up on whatever the latest information is. And that person could also join OSAP and get the information from OSAP, as well as monitoring the CDC website and others where they can make sure that they stay current on all the information and then share that information with the rest of the team members in the practice.
No question about that. Now, you touched on a little bit about the time that this takes, and that seems like it's some amount of time, but not a huge amount of time. But what about cost, incidental or extra costs that this might involve for a practice?
I think in a lot of cases it's not going to be a significant increase in cost. Most people, I think, are doing the things they need to do and the things that they're required to do, and you can actually save time by appointing somebody to developing standardized protocols, making sure that you're not duplicating efforts. And I've seen things like people using impervious barriers on equipment and then also disinfecting them. Well, if they had somebody in the office that knew what the real requirements and recommendations were, they'd know that they're duplicating their efforts and they're using more material than they need to and taking more time. So they can probably make it a very efficient process and not increase their cost a lot. Now, certainly if they're not already doing things that are required, such as spore testing, their sterilizers, there might be an increase in cost, but it's still minimal. You can spore test a sterilizer for less than $200 a year.
Right. It doesn't take it doesn't take a lot necessarily. In terms of it being 2014, almost 2015, are you aware that there's increased awareness in dental practices about the importance of infection control?
I think there is, and I think part of it's due to some unfortunate events that have occurred over the last several years in isolated practices that have, where they've had breaches in infection control. In some cases, have even resulted in infections among their patients. These have become fairly high profile in the media, and unfortunately, focus on probably the small percentage of practitioners who are not doing things correctly. What that does, though, is it might provide a positive opportunity to have a conversation with your patients if they bring up concerns about why your practice is not at risk the way those were. What are the steps that you're taking as the dental team to make sure that the practice of dentistry is safe for all of your patients?
Very good. You recently spoke at the CDA Presents here in San Francisco. How were those presentations received?
I find that over the years they're received more and more positively. I did have one dentist come up to me before the presentation that's come to a number of these over the years. I recognize him and said, "Now you be sure and not scare the audience." And I don't think that infection control is as scary for people as it used to be. And I think, too, it's important to take an approach of where, and I do believe most people have good intentions and they want to do the right thing, and all they want is some reliable information and some guidance. And if I can help provide that, that makes me really happy.
Yeah, as well it should. That's great. So then, as we wrap up, what are realistic and what are your optimistic goals around these infection control issues?
I think one of the goals that I would like to see is I would like to see manufacturers provide more information to the end user, the practitioner, on how to reprocess and handle reusable devices and instruments and materials. There isn't always enough information in the instructions for use on how to decontaminate, sterilize, or disinfect products that are used in patient care. So I think that that would be really helpful. I also think that there is an increased awareness of infection control because schools of dentistry, dental assisting, and dental hygiene have incorporated infection control into the curriculum, the clinical instruction, and also the evaluation of their students as they go through these professional schools. So now we've got this growing number of oral health care professionals out there who have always known that infection control is an important part of practicing dentistry. And so I think that that's become less and less of a hurdle. And as I said before, I also think that more and more people are understanding the need to have a trained, qualified person in every dental practice who's going to help them with their infection control. In fact, in January every year, OSAP does this core course in infection control. It's like a boot camp for infection control people, and it's great. Every year I see more and more of the private practitioners, the group practices, institutions, military, all forms of dental health care facilities sending people to that course to receive their core training. So I think that those are some really optimistic, positive things that are happening. Do some people still need help? Absolutely. And I think that we've come a long way since the 1980s when we really first started thinking about infection control, and we still have a little ways to go, but I think things are going very well.
I concur. I believe the awareness has gone up significantly, and the people I spoke with at CDA were quite impressed by your presentation. So that was fantastic to hear, and that was even before they knew I was going to be speaking with you. So,
Well, thank you.
So that was great. So, Eve, thank you very much for your time today. I hope we can do this again sometime soon, and I appreciate your patience.
Thank you.
Thank you very much. Bye.
Bye.